Infections to the healthcare industry are a big problem. They're extremely costly, and worst case scenario, they can be fatal.
Our goal at Hunterdon Medical Center is 0 infections for our patients that are coming here to have surgeries done. One of our pieces that we use to prevent infections is using nasal decolonization. Research proved that nasal decolonization decreased the risk of surgical site infections.
Nasal decolonization is important because when a person is having surgery, they're breathing through their nose, and we don't want any of that bacteria to transfer and cause a post-op infection. It's a way for us to cleanse the inside of the nose to help decrease the chance of an infection.
When we learned that PDI had developed a product, Profend, to use for nasal decolonization, we were very excited to bring that product on board as part of our program. Profend has allowed us to reduce infections because it works. It decreases Staph aureus in the nose immediately prior to surgery, which then reduces the risk of an infection after surgery.
The quality of the Profend product has definitely made a difference in the way we approach infection prevention. It's just another layer of assuring that the patients come out complication-free.
My favorite part about the Profend product is being able to give my patient an extra sense of security. I get to tell them that I want to do everything I can to keep them safe.
Hunterdon Healthcare, they had already seen the value of a povidone iodine nasal decolonization product. We were able to enhance those processes to save time for the staff. We want to make things easier for the nurses, and Profend was able to provide those benefits.
The Profend product is already encapsulated in its own solution. The swabs are pre-soaked. It's very easy to use. It's a huge time saver.
Healthcare facilities are always trying to reduce infections, improve patient care, improve patient satisfaction, and decrease cost. Profend has allowed us to do all 3 of those. We are very happy that we brought Profend on board and that we now are using that as a standard piece in our toolkit to prevent infections for our surgical patients here at Hunterdon Medical Center.